2020 coronavirus outbreak in Taiwan. The first confirmed case of the outbreak of coronavirus disease 2019, COVID-19, in Taiwan was announced on January 21, 2020. Timeline. Preventive measures before the first confirmed case. Since December 31, 2019, the Taiwan Centers for Disease Control, CDC, has implemented inspection measures for inbound flights from Wuhan, China. The passengers of all such flights should be inspected by health officials before disembark. A 6-year-old passenger who transferred in Wuhan and developed a fever was closely monitored by CDC. Back then, there was alleged to be 27 cases of the atypical pneumonia in Wuhan. Since the first confirmed case, on 21st of January, the first case in Taiwan was confirmed in a 50-year-old woman who just returned to Taoyuan International Airport from her teaching job in Wuhan. She reported on her own initiative and was hospitalized without formal domestic entry. The first domestic case was diagnosed in Taiwan on 28th of January. The first death in Taiwan was confirmed on 16th of February involving a man in his 60s who had hepatitis B and diabetes. A woman in Taiwan was reported to have tested positive for a novel coronavirus on February 19, 2020, though she had not traveled outside of Taiwan for 2 years. As of 26 February, there are 32 confirmed cases, including 1 death. Among the confirmed cases is a Taiwanese man in his 50s who was fined 300,000 Taiwan dollars for failure to report his symptoms and attempting to conceal his subsequent activities, leading to a potential contamination incident at a ballroom in Kaohsiung. A Taiwanese national aboard the Diamond Princess tested positive on 6 February. As of 19 February, 5 Taiwanese nationals aboard the ship have tested positive. The index case for coronavirus in Taiwan recovered from the disease and was discharged from hospital on February 6, 2020. Approximately a week later, a second Taiwanese national, the 10th case of coronavirus, had also recovered. 2 Taiwanese who fell ill on the Diamond Princess were discharged from Japanese hospitals in February 2020. Cumulative cases, recoveries, and deaths over time. Impact. On 24 January, the Taiwanese government announced a temporary ban on the export of face masks for a month, in order to secure a supply of masks for its own citizens. On 6 February, the government instituted a mask rationing system, requiring citizens to present their national health insurance card. Prior to its implementation, the system was extended to holders of the Alien Residence Certificate, and people with valid entry permits. People with odd-numbered identity documents were permitted to buy masks on Mondays, Wednesdays, and Fridays, while those with even-numbered identity documents were to buy masks on Tuesday, Thursday, and Saturday. Adults were allowed to buy 2 masks per week, and children 4 masks weekly. The date restriction for children under 13 years of age was to be revoked on 27 February. Taiwan's Ministry of Foreign Affairs assumed responsibility for distribution of masks to families of diplomats. On February 2, 2020, Taiwan Central Epidemic Command Center postponed the opening of primary and secondary schools until 25 February. In early February 2020, Taiwan Central Epidemic Command Center requested the mobilization of the Taiwanese armed forces in order to contain the spread of the virus and to build up the defenses against it. Soldiers were dispatched to the factory floors of major mask manufacturers in order to help staff the 62 additional mask production lines being set up at the time. The Taiwan Tobacco and Liquor Corporation and the Taiwan Sugar Corporation increased production of 75% alcohol for use in sanitization. On February 25, 2020, the Haiping Women and Children's Hospital, a branch of the Taipei City Hospital, was specially designated to care for patients with coronavirus. Due to the coronavirus outbreak, Level 3 travel alerts have been issued by Taiwan for China, Hong Kong, Macau and South Korea, Level 2 alerts for Iran, Italy, Japan, and Singapore, and Level 1 alerts for Thailand. Taiwanese authorities suspended tours to China starting in February 2020. The ban's duration was extended through April 2020, and expanded to cover Hong Kong and Macau. Taiwan has also announced a ban of cruise ships from entering all Taiwanese ports. In January, Italy banned flights from mainland China, Hong Kong, Macau, and Taiwan. However, China Airlines was permitted to fly Taiwanese nationals in Italy to Taiwan. On 10 February, the Philippines announced a ban on the entry of Taiwanese citizens due to the One China policy. Later on 14 February, Presidential spokesperson of Philippines, Salvador Panelo, announced the lifting of the temporary ban on Taiwan. On February 23, 2020, Taiwan banned frontline medical professionals working in hospitals from traveling to areas placed under a Level 3 travel alert. The ban is to remain in place until 30 June. In the aviation industry, Taiwanese carrier China Airlines' direct flights to Rome have been rejected and cancelled since Italy has announced the ban on Taiwanese flights. On the other hand, the second-largest Taiwanese carrier, Ibear, has also postponed the launch of Milan and Phuket flights. Both Taiwanese airlines have cut numerous cross-strait destinations, leaving just 3 Chinese cities still served. Filipino carriers such as Philippines Airlines, Cebu Pacific, and Philippines AirAsia had suspended flights to Taiwan because of the entry ban from the Philippines. On February 13, 2020, the executive yuan proposed 60 billion Taiwan dollars in subsidies distributed to industries affected by the coronavirus outbreak. A week later, the executive yuan passed a bill regarding further governmental response to the outbreak. Penalties for hoarding medical supplies, avoiding quarantine restrictions, and disseminating misinformation about the coronavirus were codified. The bill became law upon passing its third legislative yuan reading on February 25, 2020. The Special Act on COVID-19 Prevention, Relief and Restoration took effect retroactively from January 15, 2020, and was fully implemented upon promulgation by the Tsai Ing-wen presidential administration on February 25, 2020.